There are many examples of this. The one that I've practiced in that I find really compelling is the federally qualified health centers,
Hmm.
which I think in Michigan there are 38 or so of them. They provide a great medical home. And so why is this so important? Well, everybody's working together. Um, I find out that I have some problem, and they keep up with their patients. So I call them up and say, "Man, I'm having a terrible cough," and they say, "Well, come on over," and I go
Right.
on over, and I'm screened by typically either a nursing assistant or an RN, and then if I need to see uh, uh, mid-level, um, they're there and they're available and they schedule that way.
Yes.
If I'm like have a blood pressure of 300 over 150 and a very complicated problem, the
Yes.
physicians get involved immediately.
Yes.
So a lot of it's joint decision making. The models, I do think there's a place also, and I've spent a lot of time in rural Texas. There's a place where you can't get a doctor to practice there. Um,
Absolutely.
and they have health centers, particularly, I mean, the ones I know best are in the Hill Country,
Yeah.
where they have a PA or a nurse practitioner. Um,
Yes.
and they're independent practitioners in areas where we really need that.
Yes.
So I'm a big fan of that also. Uh, so that's where I see this interface, and I think that there's a lot of back and forth chatter about, well, who gets paid, how much they get paid, um, but generally those professions get paid well, and
There.
so I think there's a place for everybody.